And we're back with On the Record with Tiffany and my special guest, Arlet Polack. Hi, Arlet.
Hi, long time no talk.
I know, right? So in our last segment, we talked about uh, It's Time Texas and kind of gave the listener a background on the lifestyle coaches that you provide and the programs that you provide.
Mhm.
Tell us about your Healthier Texas Summit, like your new series that you guys created for all of us.
Yeah, so in last years, this has obviously been a in-person event, something it's an opportunity to provide people in the community, and not just any people, but like really prominent health champions in the community, a space to share about the work that they're doing and to also connect with other people that are doing similar things. As you know, with COVID-19, the situation has, forced a lot of organizations to adapt. And
Right.
as a result, we adapted our Healthier Texas Summit. So now it's a completely virtual event that's going on from now until, I believe it's going to be until October or September, somewhere along there. And we are just hosting virtual sessions focused around the COVID response from different organizations, how organizations are adapting around that, and not just the focus on COVID-19, but we're also focusing a lot of sessions on equity and accessibility,
Right.
healthcare overall. And these are all sessions that can also provide people with continuing education credits. It's different per session, but that's also another benefit of these virtual sessions that we have going on right now.
Oh, that's wonderful. So providers who are listening, that the healthcare staff for nephrology practices,
Mhm.
for primary care physicians,
Exactly.
they can all benefit from the behavioral health components
Mhm.
that It's Time Texas provides, and
Yeah,
other aspects of healthcare.
yeah, so many different people can benefit from these sessions. You can benefit if you're a community health worker, if you're a teacher, if you're a physician,
Mhm,
if you're a registered dietitian, nephrologist. There's
mhm.
just so many takeaways to, get from these sessions. And I would really, encourage people to look on our website and just see which sessions you feel like are going to be most useful to you and just sign up. Again, those are completely free. So it allows us to kind of add on the dissemination of information and connectedness that we're trying to really promote right now.
So they're free, and you can get CEUs at the same time.
Yes, ma'am. Yes, ma'am.
That sounds like a win-win for everybody. I mean, you're getting CEUs, which you all have to have.
Mhm.
And now this is for you healthcare providers that are listening. You take advantage of It's Time Texas. Not only is their summit amazing because our staff has attended their in-person event, so I know that the virtual event is going to be equally as exciting.
Yeah.
And then it's a good networking opportunity. It's a
Mhm.
great
Exactly.
networking opportunity, and it's because we met so many people at It's Time Texas's summit. Uh, like we met people who were from San Antonio, which is where our home base is,
Mhm.
that we hadn't met in San Antonio.
Yeah,
But
that's definitely yeah, I love that you brought this up because it's so important. It's kinda like you're so used to being in the same space that sometimes you forget that there might be things that you don't know. So this allows all of us to, including me, to kind of check ourselves and look outside of our box a little bit. And thank you for
yeah,
mentioning the networking because that was something else that I wanted to mention as well is, you're saying that you met people and it was like something that really allowed you to connect with other people, even in San Antonio, and I'm assuming maybe also
right.
in other cities.
Oh
So that's
yes.
something that that's something that we also wanted to bring into this virtual modification of this huge event. So we're still going to be offering virtual networking opportunities. So that's another exciting component about this Healthier Texas Summit, virtual summit.
And I have to give a shout out to two of my favorite people, and that's Sheena Payne and Francisco Martinez over at Blue Cross and Blue Shield of Texas, because uh, they have been instrumental in helping bring together the nonprofit world of Texas. We have we didn't have what I would have considered a cohesive um, campaign against the chronic illnesses that are plaguing us,
Exactly.
and
Yeah.
they kind of have
Mhm.
operated as being that glue that's bringing us all together. Kind of holding us all together and getting
Exactly.
the various populations that are working on diabetes, hypertension, and kidney disease to work together in ways that they haven't before.
Yeah, I think they're a huge, factor in really promoting cross collaboration across different nonprofits.
Right.
We at It's Time Texas and Living Healthier, we really enjoy collaborating with Texas Kidney Foundation, and we also enjoy getting to know people in our community. And that's something that
Mhm.
Blue Cross Blue Shield has really allowed us and really promoted for us to do is reach out, talk to your friends, connect, avoid like duplication of things, like really
Right.
try to focus on collaborating and seeing how we can, be more strategic about the interactions that we have with community members.
And how we can take our resources and make them go farther. I mean, they literally have invested resources in a variety of different organizations that together we've been able to do some phenomenal work uh, for our populations, because without an organization like It's Time Texas, we wouldn't be able to provide uh, holding every patient's hand, the patient down in Brownsville that you're able to call and work with. We can go find the disease, connect them with a free clinic in their area, and then connect them to It's Time Texas. And that takes a component off of Texas Kidney Foundation's plate and allows us to concentrate our resources towards
Mhm.
early detection.
Yeah, definitely.
You
Yeah, I
know,
think definitely in my career and being program coordinator right now with It's Time Texas, it's allowed me to really see the value of talking to
hmm
people. If you don't know, ask. If you are unsure in which direction to head, ask people. I think sometimes we're like the way we see the community, we think everybody kind of wants to hold on to what they have, and it's really the opposite of that right now. It's like we
exactly.
want we want people to utilize these resources. We need to come together for the benefit of the communities that we're targeting.
Exactly, for me coming into this, I'm very fortunate to get to work with professionals like you and the It's Time Texas family, and then uh, Texas Renal Coalition, all these different folks who have been in this for a long time and who are trained professionals. I came in as a person whose family has dealt with chronic kidney disease, and so as you know, I've lost 9 family members to it. So I really came in more looking for collaboration, looking
Mhm.
for how all of the groups could work together, because it seemed like everybody was so separate. And Blue Cross and Blue Shield of Texas, at the same time as I was just trekking along, figuring this out, I ended up meeting them. I mean, literally in the first 2 months of taking on my role. So it's been good, because it's been very educational for me. Uh, just as a regular person dealing with all of the politics and the stuff that goes along with trying to fight chronic illness.
Yes, ma'am.
there's a
Mhm.
lot to fighting a chronic illness. So I love that you guys are doing free CEUs. Man, that's that alone is should get every person interested in doing this, especially if you
Yeah.
work at a practice somewhere.
Exactly, yeah, and if we're not providing a CE for that specific course that's specific to your certification or what you may, that session is still gonna be so useful, and there's gonna be so many good takeaways for you to present to either your clinic or maybe that you wanna implement in this program that you're developing as a response to the COVID-19 situation.
Mhm.
So many benefits.
And guys, email. Email is a great way to let Arlette and her team know what you need in terms of a course, because with virtual things are ongoing. They can always look at the response to what's needed. Because our goal as nonprofit providers is always to give the public that we're serving what they need. And
Exactly,
and
yeah,
to give
I
the
would.
professionals we're serving what they need.
Exactly, exactly. Yeah, I would be happy to talk with anybody who is willing to chat about things we can do in the community. So yeah, email is a great way to get in contact with me. People can reach me at arlette@itstimetexas.org, and I'll do my best to get back to you as soon as I can.
And they always do. Arlette is great about talking to people and hearing out what you have to say, and seeing how they can help you facilitate the program that you're trying to do in your neck of the woods, because our goal is always the same thing: for us to meet the people that we're serving where they are and help them as much as we can. So, Arlette, thank you so much for your time and for your passion for the patients that we're serving here in Texas. And we look forward to talking to you again. I want to talk to you again after the summit, so we can, after the first session of the summit, so we can hear how things went and how you feel this virtual summit can be enhanced, and the people that you want to see show up to the next one.
Yeah, definitely. I'd be open for a recap for sure.
All right, you've been listening to On the Record with Tiffany, and we had a wonderful time today with It's Time Texas.